So in this short video, what I'm going to talk about is breast pain. Now, this is a very common symptom, and I'm sure many of you out there have experienced it at some stage in your life. Now, breast pain has many reasons, but I have to say that probably the most common reason that I see is to do with the menstrual cycle and the hormonal changes that occur with that. Now, simple over-the-counter painkillers should relieve that breast tenderness. There have been suggestions about evening primrose oil. I have to say the scientific evidence does not really back that up. There is very little evidence to suggest that evening primrose oil is actually going to help your breast tenderness. Now, there are other times whenever the breast tenderness doesn't occur with menstruation. Think about, are you pregnant? Go and take that pregnancy test. Have you actually strained your chest wall muscles? Have you actually, been cleaning or reaching or lifting that has actually caused a tear or a little strain in the muscle? Other things to be thinking about is if you're breastfeeding, is it mastitis, which is infection of the breast? Now, if you are menopausal, breast pain is common, but if you have passed your menopause and you get breast pain, that wouldn't be normal. But there are times whenever we as GPs need to see you. So the times that we need to see you is, first of all, if you feel at any point that something is not right, contact us. But there's a few things that we are looking for. If your breast pain does not settle with those over-the-counter painkillers that I suggested before, then we would need to know about that. If you are getting temperatures or feeling hot and shivery, that means that you may have a fever, then we need to know about that. If your breast is red, hot or swollen, that could suggest that you have an abscess or you might have mastitis. Again, we need to see you so that we could start antibiotics if necessary. Other things that we need to think about is if you find a lump of any kind in your breast, you need to let us know. And that is a lump in the breast tissue itself, under the collarbone or under the armpit as well. In any of those places, please give us a call. The other things to be aware of is skin changes. So it could be puckering of your skin, it could be tethering of your skin, and it could be of the nipple, there could be a rash. Other symptoms of the nipple that I need to be aware of as a GP would be if you're having discharge out of the nipple, or if you're having anything blood stained, even a mucus out of the nipple, I need to know about that. Other things would be if maybe the nipple is itchy and there maybe isn't a rash, I still would like that checked out to make sure that there isn't a problem. If you have noticed any change in the shape or outline of the breast, or if you see a nipple inversion, again, all of those are symptoms that as GPs, we need to see you. And of course, when you took that pregnancy test earlier on, if that was positive, of course we need to see you because we need to see you on your antenatal treatment plan. So breast pain, it's common, probably linked with menstruation or menopause in our patients who are at that age, and I've made you aware of all of the things that as a GP I would be wanting to see you with. I'll make sure that this is put into a post so that you have something to reference to, but as always, this is guidance and advice only, so make sure that if you have any concerns at all, that you go and speak to your own GP.